Welcome, everyone. Today, we're going to cover a lot of ground. Everything from how your baby gets ready for labor to how to determine if you're actually laboring, and even the nitty-gritty of what to expect right after birth. We'll also talk about a few recommendations like vitamin K and eye ointment for your baby. Don't worry, it's your choice. We just want you to be informed. Our goal today is to give you a clear, practical, and honest picture of what to expect, and maybe have a few laughs along the way. So get comfy, take notes. Let's dive in. All right. Before your baby decides to make their grand entrance, a couple of things need to happen behind the scenes. First up, cervical ripening, which we'll break down in detail in the next slides. Think of it as your cervix getting ready for action. And second, uterine contractions. These are the powerhouse moves that actually get things moving. Together, cervical ripening and contractions are basically your body's dynamic duo, prepping, stretching, and pushing things into motion. Okay, let's talk cervical ripening. Basically, your cervix is like a strict gatekeeper, firm, a little shy, and hanging out way in the back. At the start, it's about 4 to 5 centimeters long, super firm and tucked back toward your backside. Not exactly ready to party just yet. Now, here's where gravity and your baby's head get involved. They're like the ultimate backstage crew, helping soften and shorten the cervix so it's ready for labor. A quick note for first-time parents. Your cervix usually needs to ripen first before it starts dilating. So think of this step as the warm-up act before the main event. Your body is just getting in the groove. Now that we know the cervix is getting ready, let's talk about what actually changes. The cervix goes from being firm, think the tip of your nose, to soft and, quote, buttery. That's the cervix saying, okay, I'm ready for labor. There are some natural ways you can help this along. Around 36 weeks, inserting evening primrose oil at night can support ripening. By 37 weeks and beyond, frequent intercourse can also help because semen contains prostaglandins, which act like little cheerleaders telling your cervix to soften and get ready. Fun fact, hospitals use prostaglandins medically for the same reason. Your body's just naturally ahead of the game. So with a little time, patience, and some natural helpers, your cervix gets prepped for the big show. By now, your cervix is softening and getting ready for labor, and you might start noticing a few signs. One common one is sharp pinching pains just above your pubic bone. Basically, your baby's head giving a gentle, or sometimes not so gentle, nudge. First-time birthing people may also notice what's called the bloody show. Don't panic. It's just a sign that the cervix is breaking down and softening, doing its job. For those who have had babies before, you might get a bit of a head start. Previous birthing experience often means shorter labors because your cervix doesn't need as much time to ripen before it starts opening. It's like skipping the warm-up and going straight to the main event. Once the cervix is ready, it's showtime. Most birthing people have been feeling some practice contractions for months. These are called Braxton Hicks contractions. Now, when regular labor contractions kick in, the uterus really gets to work. It's a big, powerful muscle with fibers running up, down, and around. During contractions, it squeezes and pulls in just the right way, helping the cervix dilate and guiding the baby down into the pelvis. Basically, each contraction is like your uterus saying, okay, let's move things along, nudging the baby against the cervix and getting everything in position for birth. So how can you tell if it's the real deal or just your uterus messing with you? False labor, also called practice labor, is still uncomfortable, but here's the difference. False labor often changes depending on what you're doing. Move around, change positions, and the contractions can either settle down or spread out. They tend to get closer together when you're upright, but may relax when you lie down. The big clue? These contractions aren't really doing much progress. They can be tiring and annoying, but they're not opening the cervix enough to get labor moving. Real labor is persistent, progressive, and usually doesn't take a coffee break. So you're dealing with false labor. What now? First, take care of yourself. A warm bath, some rest, and plenty of fluids can do wonders. Remember the stretches we've talked about, side lying release, the jiggle, even a little inversion if you've practiced it. These moves help your uterus relax and respond better to gravity. It's also totally normal to notice more contractions at the end of a busy day. Your uterus is a big, hardworking muscle, and just like you, it responds to everything you do. So take it easy and be kind to yourself. Okay, now let's talk about real labor. These contractions that are the contractions that actually get things moving. You'll notice they get closer together and last longer. Unlike false labor, changing positions doesn't make them go away. They're here to stay. Real labor contractions can make it tricky to walk or even talk through them. You'll likely feel the contraction wrap around from your back and push down in the front, like your body is giving you a very insistent nudge that things are progressing. Basically, when your uterus is in full-on boss mode, there's no ignoring it. So you're in real labor. Now what? First, call your midwife when the contractions start getting more regular. Timing for coming to the birth center or having the midwife come to you depends on things like the weather and how far away you are. You'll probably notice a shift in your demeanor, and your partner will notice it too. The same comfort measures are happening, but now you might feel edgier, more irritable. Your body is working hard. This is usually the signal that your cervix is around 5 to 6 centimeters, and labor is well underway. So if things are feeling intense and persistent, it's a good time to let your midwife know and consider heading in. Welcome to active labor. By definition, this is when your contractions are regular and actually making progress. Your cervix is 6 centimeters or more. Quick fun fact, less than 10% of birthing people will have their water break before labor starts. So if your water hasn't broken yet, don't worry, it's totally normal. Active labor is all about those strong, regular contractions. When you arrive at the birth center, we'll start with the basics, checking fetal heart tones and your vital signs. We'll also do a cervical check to see how things are progressing. If you'd like, we can fill up the tub right away. Water can be amazing for comfort. You'll also be encouraged to walk around, sip fluids, and use the bathroom frequently. Keeping things moving and staying as comfortable as possible is key. If we're coming to your home, the routine is basically the same. Fetal heart tones are typically checked with a Doppler every 30 minutes during active labor. And when it's time to push, we'll check a bit more frequently to make sure your baby is doing great. If the birthing person chooses to labor and deliver in the tub, and there are no medical reasons they can't, the baby will be born in the water and placed right on your chest. Skin to skin as soon as possible is wonderful for bonding and for comfort. The placenta, however, will be delivered on land to safely manage bleeding. After birth, your baby stays on your chest and can begin breastfeeding right away if desired. About an hour later, we'll help you get to the bathroom, and then the baby will be weighed, measured, and vitamin K and eye ointment can be administered if you choose. Newborns are at risk for vitamin K deficiency bleeding, or VKDB, because they start life with low stores of vitamin K. Vitamin K also needs bacteria in the baby's intestines to work properly, but those friendly bacteria don't really show up until about a week after birth. So giving vitamin K right after birth helps protect your baby from bleeding complications during the first critical week. Think of it as a little superhero shield. Tiny injection, big protection. Vitamin K helps your baby's body make certain proteins that are essential for blood clotting. These proteins act like little repair crews, patching up any tiny leaks before they become a problem. By giving vitamin K at birth, we're making sure your baby has this clotting system fully ready from the very first day. It's a small step that sets your newborn up for a safer start. Vitamin K is essential for several key clotting factors in your baby's blood. Without it, the body can't clot efficiently. At birth, vitamin K is essentially undetectable in the cord blood, and the primary gut bacteria in breastfed babies, lactobacillus, doesn't make it right away. Breast milk naturally contains small amounts of vitamin K, which is perfect for ongoing support, while formula contains slightly higher amounts. This is why giving vitamin K at birth helps make sure your baby's clotting system is ready to go from day one. Vitamin K can be given in two ways, a single injection right at birth or orally. With the oral option, your baby receives a dose on the day of birth, and then 2 more doses over the next 6 weeks. The injection, on the other hand, is a one-time shot that provides full protection immediately. Both methods work, but the injection is fast, simple, and gives your baby a strong head start. Oral dosing works too, but it takes a little more planning to make sure all the doses are given on time. Neonatal blindness is in the past led to the recommendation to treat all newborns with eye ointment. The most common causes are infections acquired during birth, often related to sexually transmitted diseases. Your healthcare team screens early in pregnancy, and if everything is negative, the risk to your baby is very low. Even so, applying a tiny bit of erythromycin to your newborn's eyes right after birth is an easy, quick step to help prevent rare but serious eye infections. After your baby is born, we'll check vital signs for both you and your newborn to make sure everyone is doing well. You'll be encouraged to get up a second time to use the bathroom, and we'll provide any help you need with breastfeeding. We'll also encourage you and your support person to have something to eat, and of course, rest is a top priority. In the birth center, once everyone has met their milestones and it's an appropriate time of day, you'll be ready to go home. Before you leave, we'll review postpartum handouts and go over emergency signs and symptoms to watch for in both you and your baby, just so you feel confident heading home. In the first 24 to 36 hours after birth, we'll do a home visit to make sure both you and your baby are doing well. For your baby, we'll check vital signs, weight, and perform the CCHD screen using a pulse oximeter on the right hand and foot. We'll also do the first newborn screen test, a quick heel stick to check for things like thyroid or adrenal gland concerns. For you, we'll check vital signs, examine the uterus and the perineum, and provide any assistance needed with breastfeeding. This visit is also a great time to ask questions and get guidance on those first few days at home. Think of it as a little safety net to help you feel confident and supported. About 3 days after the initial home visit, we'll check in again, mostly to weigh your baby, but also to see how you're both adjusting to your new little family member. We'll assess bonding, answer any questions, and make sure everyone is settling in comfortably. Thanks for so much for listening today. Remember, every birth is unique, and we're here to support you every step of the way. No question is too small, and no concern is too minor. Your comfort, safety, and confidence are our top priorities. Welcome to this amazing journey of parenthood.